I'm going to show you the window wiper movement. So the reason it's called the window wiper because we're going to move the legs in a way that looks exactly like a window wiper. So there's 3 versions to this. The first version targets mainly the hips. The second version introduces some lower back movement, and then the final version involves the mid back or the thoracic region in the movement. So the aim of this is to improve rotation of both the hips and the spine overall, which can contribute towards reducing back pain and just feeling like we're a bit more mobile. So we start sat down, knees bent, heels in but toes lifted up, hands behind, and the first version is going to focus up at the hip. And what we're going to do here is, whilst one leg stays nice and vertical, the other knee is going to drop down towards. So you may find you get halfway because it is quite a tough movement to do, because it is focusing really in at the hip joint and the muscles that surround it. Going to hold for a second, and then we drop down and move the other leg. So I like to do about 5 to 8 each side, and within that amount of repetitions you will generally find things are moving much easier. The second version is we're not going to keep one leg vertical, we're actually going to allow that to drop down. So hands stay behind, but as the knee drops down towards the ankle, the other knee drops down towards the floor also. So this is now introducing more lower back movement, and sometimes feels a little bit easier, or if you are stiff in that lower back, it might be a bit more difficult than the first version. And the final version is a continuation of that movement, but we're going to bring one arm around and to reach through. And this now introduces some mid-back or thoracic rotation to the exercise. So this is really good about improving overall rotation of the whole back. So again, 5 to 8 each side, or to perform it until you feel there's an improvement in your overall mobility. So just to recap, we have just the hip and drop the knee down. We have both hip and lower back. And we have both hip and lower back and reach through. Let's give it a go.